I've run 13 marathons. Every time after you finish, you think, oh, I'm not going to do that again. That was so much work. I'm so exhausted. And then a couple weeks go by and you start thinking, I need to have a goal again. So it's addictive, really. It makes me feel physically good, mentally good, and it's just always been my passion. I sort of had in my head that I wanted to run the 2015 Boston Marathon. About 2 months later, I found a lump in my breast and ended up having a biopsy, coming back as breast cancer. And I had a postcard up on my fridge that said, you've been accepted into the 2015 Boston Marathon, and I was not going to let this cancer not let me run. It definitely seemed much more feasible in November when I first found out what they thought was going on, but by the time January came and the surgery was a mastectomy as opposed to a lumpectomy, the treatment was chemotherapy as opposed to radiation, all of a sudden it sort of seemed, is this going to be possible? A few days later, I got a phone call from the oncologist, and he said, there's a clinical trial going on with Dr. Lisa Carey, and I think you're eligible, and I think you should really consider it.
So the chemotherapy gets delivered into the cancer cell, and presumably not much elsewhere. It does mean that people typically keep their hair. They have fewer of the traditional chemotherapy side effects. And in someone like Amy, it means you can keep running marathons.
I did the first treatment, felt fine, had the second treatment, and now it's sort of decision-making time. And I looked at my husband and I said, you can't finish if you don't start. So the whole family bought 5 tickets, and then I was committed. I'm running this marathon. I was sort of all of a sudden transformed back to marathon running Amy. It was more about getting to the finish line than it was about what's my time gonna be. It was 4 hours and 5 minutes. I crossed the finish line, put my hands up, and just sort of knew in my own head, you've been through a rough 6 months and you did this. That night I had all these emails from all these different people. One of them was from Dr. Dees, who had said, I can't believe Amy ran the marathon on active treatment. I followed you all day. I'm so impressed. I've been really lucky that Lineberger has this clinical trial to offer someone in my situation.
Not all of my patients are running marathons, but she's been able to really keep up with her life and keep it as normal as possible.
Personalized care is allowing us to make inroads for each individual patient. We're really bringing brilliant basic science minds and the humanity of care for patients together.
It allows people to, not be defined by their cancer, to keep living their lives. You just can't take a year off from life or 6 months off from life. You need to keep going during that period.